Great. Thank you so much for having me. Assalamu alaikum. I am going to give you a very brief introduction into health research methods. I am a global health lecturer at the Brighton and Sussex Medical School. I'm also a research fellow at King's College London. I teach and lead a module on research methods, and I, in particular, focus on qualitative health research methods, looking at creative arts-based ways to do research. But this lecture is going to be very introductory. It's going to try and hopefully cover a broad range of things, answer questions about research, what it is, why we do it, and how it's done. And I'm going to end with some examples of some research papers, and then hopefully we can get a sense of what you think is useful and what you would like to hear more on. And then if there is interest, we can arrange for further sessions. This is me, and you're welcome to email me as well if you have any questions, or get in touch with me on social media. I'm more than happy to answer any questions. But hopefully in this session, you'll be able to understand what health research is and the different examples of health research, discuss ethical considerations in health research. So often when we think about research, ethics is the last thing we talk about, but hopefully in this context, it's going to be the first thing we're talking about almost. Hopefully you'll be able to describe key methodological approaches, methods, and analytic techniques by the end of this lecture. And hopefully we'll do a bit at the end about, in particular, writing a research paper, what the different parts of a standard research paper are. So yeah, what is health research? So at a very basic level, here you've got a definition from the UK Research Institute. Any research that aims to improve human health. So that's kind of a positive definition. So it could be about creating new knowledge, for instance, around new medicines. It could be about improving existing practices, maybe about how services are delivered or how efficient testing is. Could be about reducing inequalities between different population groups. Research could be to support real-time clinical decision-making. There are loads of things that research should be. Fundamentally, it is just creating knowledge. Research creates knowledge, and health research creates knowledge about health. And so here in this image, you can see there are lots of, I suppose, different examples of different things that could constitute research. You know, obviously, you will come across clinical trials. You will come across epidemiological studies, which look at the cause and effects, the trends of disease. So, you know, over time, geographically. There's a big branch of health research around health services research to look at how people have access to healthcare? Do they have access to medicines? And once they do, are they receiving quality care? There's health systems research looking at how different countries establish their health systems, thinking about national insurance schemes, thinking about public versus private control of health services. So health research is incredibly broad. And if you think about well-being and mental health, it gets even broader and can constitute and encompass almost anything. So why do we conduct health research? I think it's good to start with the ethics, and it's good to start with the motivations. And obviously there are many different motivations to do health research, and you will all have your own, which I'm going to ask you about in a second. But this is from, I thought the example of Dr. Hannah Atisha is an interesting one. So she is a Iraqi refugee. Her family fled during Saddam Hussein's rule, and she ended up in the United States. And did a lot of research on how companies were poisoning a local town's water supply, and it was affecting. There was lead poisoning basically in the water, and it was affecting children's health in particular. And so I think she's an interesting example because she says as an Iraqi immigrant, I'm acutely aware of what injustice can be and what people in power can do to vulnerable populations. So she's got a very much a social justice motivation. She wants to do health research to hold people in power to account. But also she wrote a book about the what was happening. So there is also a career aspect. There's a to feel fulfilled, to make money. There's you might be working in a clinical context and you might be dissatisfied with how the care patients are receiving, or you might be dissatisfied with the government's public health policies, and that might motivate you to do research. So there could be perhaps a policy political angle. You might want to do research because of a services angle as well, like an individual patient to doctor basis. And there's a broader societal angle of why you do research. We always want more effective treatments. Often treatments become increasingly ineffective. So there's a constant need to do research, a constant need to update and improve our knowledge and to improve people's quality of life. So what I did want to just say is that obviously health research isn't always good. It isn't always positive, and health research can be used to further oppression. So in my field is global health, and global health research in the way that we know it today started because Europeans wanted to colonize the African continent in particular, and what was happening was that they were dying. They were coming and they were dying of many diseases, in particular malaria. And so in response, the UK government and other European governments poured money into research into tropical diseases, quote unquote tropical diseases. And so it's founded many famous institutions like the London School of Hygiene and Tropical Medicine. So my field started as a way to support colonizers to take over Africa. And, research has been used throughout history to support and further colonial oppression. So, obviously there's an example in the Algerian War of Independence, where French psychiatrists were trying to say that, look, we've done a lot of research on this, and we can show that Algerians who rebel are sick. Basically, this is not the normal way of things, and it's a way of undermining the resistance. So I think it's just important to say that not all health research is good health research. It depends who does it, who is funding it, why they're doing it, and there's a history of doing health research which isn't ethical. And so this gets on into research ethics. So a lot of the ethical principles that we sort of vet research by is based on bioethics, basically. And during World War II, Japanese and Nazi doctors in particular did some very horrible experiments on people. And this, during the Nuremberg trials, this led to a sort of a code of practice for medical research in particular. And this code of practice was then developed and worked on. I should say, even after World War II, terrible experiments kept continuing to be done. So we've got an example here of the US syphilis experiment, and perhaps you can watch this video perhaps in your own time, but basically there was, and some of you might already be familiar with this, there was a 40-year experiment on particularly with Black Americans, where they were deliberately they were given syphilis. They were not treated for it because doctors wanted to find out what happens if you leave it untreated. And as you will know, untreated syphilis is causes, well, it can kill people, but it can cause lifelong problems. It can cause intergenerational issues, and some very twisted things were done. In the government when people were being called up for the draft for the Vietnam War. The U.S. government, the people running this experiment, tried to hide people from the draft and exempt people, because if they were called up to the military would do medical tests on them. They would find out they have syphilis and they would treat it, because very shortly after this experiment there was a treatment developed. So it's not just basically, this is all to say, but the unethical experiments were not just Nazi doctors and Japanese doctors, but they were also US medical researchers, targeting people who were, I guess, had less rights in their community. And basically these principles are beneficence, which is your research should do good. They're non-maleficence, your research shouldn't do harm. They're autonomy and respect the person. So your research should respect someone's individual rights to choose, to voluntarily be part of a study, to be part of a research. And a justice. The research has to be just. It has to, I guess, fulfill some sort of social goal and be fair to everyone. And these are the bioethical principles on which health research, all research, but health research in particular, is based on. So if you want to do a piece of research, you apply to an ethics committee to approve your research, and they will approve or reject that piece of research based on these principles. Obviously, though, there are many issues with these principles. Justice is a very, very vague concept. It depends who is defining it. It depends what your philosophy is. It depends, what your viewpoint is. These values, if you can see, they're very much focused on the individual. They're not focused on the community. They're not focused on what is the greater good for your community. They're focused on what's good for the person. So again, it's coming from perhaps a more Western viewpoint. There are key values that are missing here. Values around praxis. So basically, isn't it important that your research makes a difference? Like, that's a bit hidden. There are other principles like, okay, maybe it doesn't harm a person, but maybe it harms the environment. Maybe it harms, why is that not important? And because it focuses on the individual, it often misses bigger oppressions, bigger structures. There's perhaps these ethical principles don't really, they are set by universities, they are set by governments who themselves have a lot of ethical issues, and that's not really recognized. Can you do ethical research in particular institutions which are collaborating with governments to do terrible things? There is this isn't really considered in this ethical framework. It comes into a lot of problems, especially when people who have experience of an issue, experience of a potentially health issue, want to do research on it, because often an ethics committee will then say, well, this person is too vulnerable to research this issue, or they will, this ethical framework is about people being researched on, not necessarily people being researched with, or people who are affected by something during the research. So if you are, by the way, interested in ethical issues, there is a group that I host, a group of academics and NGOs, and we talk about and try and support each other and give advice to each other on ethics in research while we're doing it. And you're welcome to join that.